This is Chicago's very own WGN News at 9.
Cosmetic surgery was once performed only on movie stars or the rich, and for the most part, the recipients were women.
But today, prices have dropped and the times have changed. Men are going under the knife almost as often as women. WGN's Robert Jordan joins us tonight with a procedure that's changing many lives, right?
That's right, Stephen Allison. The possibility of facial scars from removing bags under the eyes has kept a whole segment of the population from having cosmetic surgery. The more color you have in your skin, the more likely you are to show surgical scars that may leave a thin white line as the wound heals. But now, surgeons armed with new techniques are helping patients unpack their bags for good. Under eye bags, either you have them or someone you know does. Cosmetic or plastic surgeons have been removing bags for years, but for the most part, only white women have historically had the operation. Dark or brown-skinned Greek, Italian, Hispanic, or African-American people with bags have been afraid of the surgery for fear of scarring, but not anymore.
Over the next 2 days, you are going to be exposed to many revolutionary techniques in cosmetic surgery, which is removing the bags from the lower eyes with no visible scars.
Dr. Anthony Geroulis is teaching this surgical procedure at the University of Chicago to other doctors from all over the country. The operation has become very popular now that almost anyone can have it.
I have dark circles anyway, but with my eyes being deep set, they always looked bad. People would say to me all the time, gee, you look so tired.
Of course, I was afraid of scarring.
And with this procedure,
I understand,
inside.
Right, I understand that all of the work is done behind the lid so that there is no visible scarring.
The surgery today is being done as a teaching tool at the U of C. Geroulis normally does the procedure in his Wilmette office.
On the lower lid, I'm going to administer the local anesthesia through the lower lid, protecting the eye at all times. After it has time to take effect, I'm then going to make an incision using either a cutting cautery or the laser. And I make that incision through the conjunctivum.
Through the inside, the pink part of the lower lid, not the outside. Once the incision is made, Geroulis begins to carefully cut out the fat using a tool that emits an electric current so that there is no bleeding.
But by taking out this fat, again, you'll continue the sculpting process on this lady and getting her that look that she's desirous of.
The procedure allowed me to do something that I've wanted done all my life. Recognize that guy? That's me, just about 4 months ago. Look at the size of those bags under my eyes. Here, let's take another view. Look at that one, or that one. Look at how large they are. Now, with the old procedure, I would have been cut under the eye, and that could have left scarring in the front. But with this procedure going inside the eye, there is no scarring. And just 4 months later, tremendous difference.
If they're looking like they partied all weekend on Monday and they really just sat at home and rested, okay? Those are the candidates for this type of eyelid surgery.
Well, that lower lid surgery takes about 20 to 30 minutes, and patients go home the same morning. And they have to sleep, though, at a 45-degree angle for a few days, and then they're back to work in less than a week.
Bob, I know a lot of folks, you look great, by the way. I know a lot of folks are wondering whether insurance pays for the operation and how much it costs.
Insurance does not pay for it because it's considered cosmetic surgery. So the idea is to find someone that you know has a good track record. Geroulis is one.
Okay, silly. Is there any chance that the bags will come back?
No, they don't, because just like liposuction, once the fat cells are removed,
gone, right.
It's gone and they don't come back. Okay. So it's a one-time surgery.
Really? You do look very, very handsome.
Well, thank you.
You always were, but...
When it comes to plastic surgery, most everyone knows someone who has gotten a little nip here or a tuck there. And while most procedures are generally considered safe with a skilled physician, some experts say too much of a so-called good thing can actually be dangerous. And joining me now with more on this is board-certified plastic surgeon Anthony Geroulis. Thank you, Dr. Geroulis, for being here today.
Thank you.
Now, procedures like facelifts and tummy tucks have really become very commonplace, but when it comes to getting multiple procedures at one time, can you do it all at one time, or is it better to spread them out over weeks or maybe even months?
Well, it really depends on the area being operated on. If you're working in the facial area or the head and neck area, you can do multiple procedures quite safely. if you're going to combine the facial area with other body areas, whether it be the chest or the abdominal area or the legs, then I believe it becomes too dangerous.
Do you think that shows that depict plastic surgery, we've got a lot of them on the air now, that maybe they give prospective patients an unrealistic expectation of what they can actually go in and ask for?
I do. I think that they do a lot of Hollywood in a lot of these shows, to be very frank with you, and oftentimes the public gets misled and believes that they can go in, have all of these procedures done at the same time, and walk out and be at dinner a week later, and I think it's very misleading.
Now, you mentioned that there can be possible dangers a moment ago with people getting multiple procedures on multiple parts of the bodies. What are some of those dangers?
Well, first of all, the biggest danger is the length of the surgery time. The amount of time a person is under anesthesia is critical in terms of their heart functions and so forth, and therefore there are certain limits that people have to watch. The surgeon and anesthesia people will watch that closely. The other factors that come into play, if you do multiple procedures in the facial area, for instance, from a sculpting and an artistic perspective, you want to account for the swelling. Therefore, for instance, I sculpt and I would not do a nasal operation at the same time I do the eyes because of the swelling playing against each other.
Thank you so much for your time, and I guess the bottom line here is more is not necessarily better than it's still surgery. Thank you, Dr. Geroulis, for being here today.
Thank you.